This is Wednesday, July 13th, and I'm with Frank Pauls in his very lovely home. Let's start with what came before Earl, because I had understood when I first got into this business, as I think I may have told you, that he was the first Commissioner of Public Health, and I've certainly found that that is not the case, that there was a Public Health Bureau or something of that nature. And I've got to be clear about that in the book. Okay, so can you tell me what went on before he came, as far as covering health needs for the state, or for the territory?
Okay. Well, when Alaska became when Alaska was a territory, there was always a need for health coverage. And so in the early days, very real early days, this was provided by the local doctors. And then when the Organic Act was passed, there was a board, not so much a board of health, but there was responsibility of health. And there was a commissioner and his deputies.
And where was he based?
The commissioner was based in Juneau.
Even then?
Even then.
Yeah.
Because remember, at that time, Juneau was
what years are we talking about?
Well, I'll take it from about 1914.
Oh, I see. Okay, so there's that. Okay. When you said early days, that's what you meant, even before World War I. Okay. Uh-huh.
And so they had a commissioner, and he delegated responsibility to his deputies. And these were all the commissioner and everybody else. They were all full-time positions. This was a part-time job. And
the deputies were part-time?
Yes, and so was the commissioner.
Okay.
I mean, he was not a full-time person. I mean, it was a individual that was in private practice in Juneau.
When you say commissioner, did he have a title as commissioner of what? Would he have been commissioner of public health? Was there such a bureau at that time?
I think he was the commissioner.
I'm going to go I'm going to spend a week or more in Juneau, and okay. I can probably find some of that.
Let me try to clarify that and get back to you on that.
All right. Don't do any work out of Frank, because if I don't find it in Juneau, then I'll probably ask for some help. But they ought to have some of this information down there.
Maybe not.
Maybe not.
Yeah. Anyway, they had the responsibility of reporting diseases and of carrying out vaccination programs and issuing the vaccines. Now, this system held all the way up until about 1936.
Okay.
In which there was the commissioner at that time, in about 36, was Dr. W. Consul.
Would you know how to spell that?
Yes. Consul, C-O-U-N-C-I-L.
Oh, just that kind of a consul. Okay. Mm-hmm.
And then he had his deputies. Again, they were out in Fairbanks, Anchorage, and in Nome. That was in each of the judicial divisions.
Mm-hmm.
And at that time, the Social Security Act was passed. And part of that included the health, public health.
Really? in Social Security. That's interesting.
And so part of that was to assist the states and the cities and the counties in strengthening their health departments and establishing health departments.
Would Anchorage have had a health department at that time?
No.
Did any city have a health department at that time?
No.
So it was just really a case of getting them started on it.
That's right.
Yeah.
Now, when I say about this time, remember, but when they said the cities, this would be like San Francisco. And
Oh, I see. Oh, you weren't speaking just of Alaska.
No.
All right, okay.
I'm talking about the national scene.
Okay.
So therefore, the territorial legislature authorized the Commissioner of Health, Dr. Consul, to work with the federal government to secure the money for public health purposes and meet their conditions. And by that time, Nancy, if I remember correctly, we did have a territorial board of health. Because Consul, I believe at that time, yes, he had to responded to a board of health. There was a territorial board of health. And
appointed by the governor, perhaps?
Appointed by the governor. And so the Consul then worked with the federal government to help to establish a public health department within Alaska.
Would you know what branch of the government this would have been under, or was it its own branch? Was it its own autonomous agency? Did it have to respond to any other department head?
Part of that came under the Children's Bureau. Because the Children's Bureau also predated this with their own program on Children's Bureau's programs.
So the territory already had that before this Social Security thing?
They had some of that in there, but not very much.
Okay.
So it was the Children's Bureau. And I think it was also, I'll almost say with a public health service. That would be that was the responsible agency overriding. And I'll have to check back on that now that you're raising.
No, I don't want you to do any work. Let me do this. If I can't find it, I'll ask you some help.
Well, I should know because I've been talking about it all the time. Well, anyway.
Sometimes the details get lost.
So this is when the Dr. Consul, with the assistance of the feds, which was the Public Health Service and the Children's Bureau, organized a Department of Health.
Okay.
Now, it was a full-fledged Department of Health with all of its facilities. But it was organized under the Territorial Board of Health.
Okay.
And so, see, we had Dr. Consul as the commissioner. But
So you really had a commissioner for public health? Well, I don't,
And so, but he was the commissioner of public. He was a commissioner of health, appointed and responsible to the Territorial Board of Health.
Okay.
And it was a Territorial Board of Health. And we operated under that for many, many years. Actually, we had no authority as a department. There was no such thing. I mean, you couldn't
Legislature hadn't set you up in. Did you get any funding from them?
Oh, yeah, we still got funding, but it was always as a territorial board. Everything.
The board got the funding.
Territorial board itself.
I see. Did you work for this? Where did you come in on this?
Well, I came in. You see, I was in school at University of California.
Okay.
At the time, the Social Security Act went into effect.
Yeah.
And I was caught up. I was in my junior year.
Uh-huh.
And I was already working in public. I wanted to go into public health anyway. I was in the laboratory work program. And all of a sudden, there were only 12 of us that were admitted to the department every year.
You mean at the university?
At the university.
Yeah, okay. Mm-hmm.
And all of a sudden, with the passage of the Social Security Act,
right.
The school was suddenly asked, we need to have trained personnel.
Right.
We have to set up training programs.
Mm-hmm. Mm-hmm. We
need to have trained epidemiologists. We need to have trained public health nurses. We need trained sanitarians. And we need trained statisticians.
Mm-hmm.
And the school was setting up 3 months training programs, what we call the 90-day wonders. We were cranking them out like crazy.
Yeah.
And so the programs that we've been working on for 2 to 3 years were being compressed into 90 days.
Isn't that incredible?
To a certain extent.
Yeah. Well, at least you had 3 years in there before you had to go through this. Well, what was your major? Was there such a thing as a public health major?
Well, I was in microbiology. I was in public health microbiology.
Public health. What was the university department? Biology?
It was in the Department of Hygiene.
Oh, okay.
Which later became the School of Public Health.
I see. You know, that doesn't seem to me that so long ago, but and yet this sounds so primitive, doesn't it, that we didn't have these things in place?
Well, they were in place, but I mean, up here, remember, we didn't have all these people.
Yeah, that's true. Uh-huh.
So, you see, that was in 36. I graduated in 38. Mm-hmm. And did my internship down in Santa Clara County Hospital. Finished that up because we had to do an internship.
Well, what kind of a degree did you get out of that?
Well, that was just my bachelor's degree to start out.
Okay, but that was just a Bachelor of Science?
That's letters in science.
Okay. Mm-hmm. Mm-hmm.
And then I worked with the state health department for a short while. And then the offer came to come to Alaska.
Okay.
And they were just starting up at that time. They'd been in existence. So back in 38, they'd already been in existence about a year and a half.
Okay.
So I came up to be the second person in the laboratory.
Did you work directly under counsel?
No, because Warren Evelyn was my boss.
I see.
He was the chief of laboratories.
Okay.
And then Dr. Consul, of course.
And what was Warren? What was his last name?
Eveland.
E-V-E?
E-V-E-L-A-N-D.
All right, and he was the head of the lab.
He was the head of the lab.
And that was in Anchorage.
No, this is all down in Juneau.
Oh, well, still in Juneau. Okay, yes, I knew you eventually did get to Anchorage.
Because you have to remember, Nancy, at that time, Juneau was the metropolis.
Yeah, I guess, yeah.
The whole territory only had 70,000 people.
Isn't that amazing?
35,000 natives, 35,000 whites.
Isn't that something?
Juneau had the biggest population at that time at 5,000. Anchorage, well, summertime maybe you could have a population of about 2,000 to 3,000. Winter population of 1,500. Fairbanks was bigger than Anchorage.
In 1938? I don't know, maybe you don't know, John is helping Bob Atwood on this autobiography of his.
Good.
Oh, well, yeah. Yes and no. Sometimes John doesn't want to get into this. But Bob's supposed to be doing the writing, going up to John still would be steering down the right path. And he came here in 35. And I don't hear him talk about the town as being, down at 1,500 at that point.
Maybe.
Or even,
Could be a bit more. Maybe 2,000-3,000.
Had the military started to come in yet? No.
Anchorage then was still just the Anchorage was still the sort of a little settlement, just the headquarters for the railroad.
Yeah.
That's all.
Yeah.
And then it was also a supply point for McGrath and that part. Fairbanks was still the thriving and the bustling part, the supply point for all the north, and all the Nome and everything.
Yeah. But everything really emanated out of Juneau as far as the authority was concerned. And you were based in there.
Yeah.
How many deputies would you have had at a time like that? Were you still covering just Nome, Fairbanks, Anchorage, and Juneau?
Just the judicial division.
Just the judicial. And approximately how many people would you have had working in the whole department?
About 25.
Mm-hmm. Okay. These all had to be pretty much recruited from outside, I would do.
Yes,
they? Yeah. Mm-hmm. What was the main concern, the main health concern in those days? Was it immunization, or were you worried about the TB even then?
Yes.
Were you?
TB. Well, we knew that TB was our biggest problem.
Okay.
And well, it was the infectious diseases.
Okay.
And so after TB came the gastroenteritis problems, the enteric diseases, typhoid.
Did you have typhoid? I noticed that one of the things that I found, I found some a collection of old newspapers up in the Palmer Library, but just a little thing that was put out up there. But it's great because it's got actual dates on it and so on. And in it, there's just a reference that Dr. Albrecht will be giving typhoid shots between 9:30 and noon this week. And I hadn't heard any reference to typhoid at all before that.
We had typhoid around. I mean, that was one. But diphtheria.
Why would you have typhoid? I always said, doesn't that come from bad water?
Sure. Contaminated water.
Yeah.
Contaminated food, primarily contaminated water.
This place seems so, those days must have been so clean. No? No. Was it mainly within the native population? Were these illnesses mainly within the native population?
No, as a matter of fact, the most fascinating thing was typhoid was brought in by the traders. And one of the biggest spreads of typhoid came during the Klondike Gold Rush.
Is that right?
Dawson had a gigantic typhoid outbreak.
Huh.
They don't talk about it very much.
No, I never heard it.
But as a matter of fact, it was in the spring of about 1988. And people were dying like flies, and they said they had bodies stacked in the street.
Isn't that
people
something?
were fleeing.
This is in Dawson?
Dawson, and going down river, dying along the river.
Nice stars.
You'll see references in Bishop Rowe's book and a couple of others about the nursing that he gave.
Oh, really?
To the men on the trips from St. Michael down to San Francisco. And so they more or less brought typhoid all up and down the Yukon. Then the men had to stay in St. Michael while waiting for shipment or for catching the boats to go down to San Francisco. of course, sanitation was primitive.
Yeah.
Contaminated the water and everything else. Spread into the Eskimo population. It traveled up and down the coast in Norton Sound. And it was about 1940. We had an outbreak of typhoid up in Norton Sound at Govan. And the carrier of that remembered having having a disease when he was a youngster down back at St. Michael.
And one person could cause that war outbreak. One carrier.
Mm-hmm. We had carriers scattered all over.
What was available for those people in those days? Was it just your people who were in those districts? Was there anybody? Was the BIA in there at all?
Of course, the BIA was in serving the native population.
Yeah.
Then there was the hospital at Fort Yukon. That was one of the church hospitals.
Churches,
But there was primarily the BIA hospitals, but they primarily took care of the native population. But of course, there weren't too many whites on it.
Yeah. Mm-hmm.
But our big problems you were asking about the early days were the infectious diseases, communicable diseases. I mean, that was our big concern.
Mm-hmm.
Tuberculosis was a big one, and so that was the early push.
Mm-hmm. Did you have any idea of how widespread it was?
They weren't sure about it, but one of the very first things that the early department did. Dr. Carswell was the director for the community disease control. Mm-hmm. He hired young doctors, and at that time they had portable X-ray units called picker units that were in wooden boxes. So they would fly out, and then from there on go by dog team or any ways that they could go, and did the initial survey of all of the villages.
Of all the villages?
As many villages as they could. I mean, we did tuberculin testing and then X-ray. And very roughly, it was about, they came up with, they had over 5,000 active cases of tuberculosis.
Really, yeah.
And so this was a constant push.
Did you have any sanitariums in those days?
We had sanitariums. I mean, we had sanitariums. We had, as a matter of fact, we had a sanitary engineer and 2 sanitariums to cover the territory. Now, one thing that you also must remember was transportation. It's not like we have now. Mm-hmm. And so one sanitarium covered southeastern Alaska, the other sanitarium covered what we call the westward.
Mm-hmm. Dillingham and that area? Bethel?
Anchorage, Fairbanks.
Oh, okay.
You see, when you
anything west of Juneau.
That's right. You see, when you were in Juneau, when you caught the boat, you went west.
Okay.
You were going to the westward.
All right. All right. Well, the poor sanitarium had quite an assignment, didn't they?
And sure. And of course, the salmon canneries, and they were charged with responsibility for the inspecting all the salmon canneries. Some of the dairy farmers, we had dairy farmers, and then of course with the Matanuska Valley coming through, and dairy farms, they were responsible for dairy inspections, milk inspections.
Then that's humanly impossible.
Then they were also supposed to check out all the food handling establishments. So they had to plan their visits in such a way that they would leave Juneau in April and make a spring, which meant they had to go by boat to Seward and then go by train up the rail belt. So they would do that.
Mm-hmm.
Then it meant getting a plane, go from Anchorage out to Dillingham, and then catching little float planes to go hippity-hoppity to cannery to cannery and cannery to cannery. When they get to Fairbanks, they'd fly out to
I can't believe something about this hasn't been written before. It's such a story. Hasn't this ever been written before? This is an incredible story. What these people do.
I mean, and of course the thing was, see, they had to get samples back to me, and I'm sitting down in Juneau. And of course everybody briskly has all their recommendations, how everything must be kept refrigerated, must be examined within so many hours.
Oh, yeah.
We had to break every rule in the book. We had complete cooperation with everybody.
Yeah.
I mean, the steamship lines gave us cooperation.
Uh-huh.
Post offices gave us cooperation.
Uh-huh.
But a boat only goes so fast, and a train only goes so fast.
Well, were these samples of any value once they got to you? Yeah.
We could do it. And I mean, if they were borderlines, no, they weren't of any value, but those that were grossly contaminated came through.
Yeah. But what happened in the time space here, by the time they would find this out and get it back to you, and then you would issue your report, the cannery would have been closed down for the season or something.
Well, they had to, on the canneries, the laboratory didn't, everything was visual.
I see. Mm-hmm.
They had, it was what they would see visually.
Okay. What sort of authorities did these people have when they went out in there? You know, if they found a cannery that had broken the rules and didn't make any attempt to correct them, did they have the authority to shut them down or anything?
They had a great deal of authority.
They had, didn't they? Mm-hmm.
Yeah. Mm-hmm. And at times, I mean, the canneries would try to bluff.
Yeah.
But again,
could they close it down? Could they close the cannery down?
Well, they would give the cannery a hard enough time that the cannery would try to comply.
Okay.
Our sanitariums too worked in cooperation with the Food and Drug Administration, or even, I mean, there wasn't a Food and Drug at that time. I don't know if there was or not. I don't remember.
With the federal agency.
But they worked in cooperation, and so sometimes they were doing the federal agency work too.
Okay. Uh-huh.
So they did carry authority.
Uh-huh. Uh-huh.
Now, when you go to Juneau, along the way here, I'll give you some names.
That'd be great.
The sanitarian and the man that also has a history, he arrived in Anchorage in Juneau about 8 months after I did. And he was a sanitarian.
Mm-hmm. Mm-hmm.
And that's Lloyd Morley.
M-O-R-L-E-Y?
M-O-R-L-E-Y. Mm-hmm. He's retired. And he can tell you all of the early days. And as a matter of fact, he can tell you about the sanitation program and its developments and what happened and its changes up until about the 70s.
Oh, that's very great. That'd be great.
And then the other person that came in a little later, he was a sanitary engineer.
Okay.
And that's Joe Alter.
I have his name on a list that Helen gave me. And is he out in Juneau also?
He's also in Juneau.
Okay.
Now, Joe will can talk more from the standpoint of the engineering, the water systems, and the problems they encountered, waste disposal systems. And he was the he was in the head of the Division of Sanitation and Engineering.
Okay.
Lloyd worked for Joe.
Okay. Did you, maybe getting ahead of it here, but this was 38, and Albrecht came there in 44. Am I correct?
Oh, no. Where came
to Juneau in 44 as head of the public health aid. He had gone at 40, he had gone to Fort Richardson, and then before the war ended, Greening had come in as governor, and appointed him to the Commission of Public Health. I came across some tapes that were done by a fellow named O'Neill. I'm not sure who O'Neill is, but this was part of the oral history program that UAF has been conducting. They're building up a bank of oral histories. And this was done about 6 or 7 years ago. And in there, Earl talks about that and said that the war was winding down and they realized that Alaska was not quite as vulnerable as they had once thought it was going to be, and that he was told that he would have to go to ADAC if he was going to stay in the service. He said, I am not going to go to ADAC. And at that point, Greening came up with this offer to be head of public health, and so he took that rather than go to ADAC. Now, did he displace council? Was council?
No. Well, I mean, I left you with council.
Yeah.
But there were other doctors.
There are others council. Okay.
There was Dr. Blandford and let's see who else came in.
Uh-huh.
Whitehead was in there. Cass Carter. It was passed around among the doctors at the Juneau Medical and Surgical Clinic. And also during those years, there was actually an assistant commissioner.
Mm-hmm.
That was appointed, that was loaned. I think that was George Hayes. That was more or less running the department full time.
Were these others just more or less figureheads? Okay.
You see, because we were still functioning under the Territorial Board of Health. Then, well, let's stay just on. Then it wasn't until the late 40s that the territory, because we were still a territory, officially established the Department of Health.
So in other words, when Albrecht came in there really was not an established Department of Health, because he came in 44.
Well, so it was the Territorial Board of Health.
Okay. But there was not a real Department of Health. Maybe this is what they mean by first one. Did he establish the first one?
So all what they did was, the framework was there, the whole framework was there.
The whole operation was there.
The whole operation was there.
Mm-hmm.
And suddenly, the Board of Health became Department of Health.
I see. But this was something that Greening did. Yeah.
Well, then it was in the, I don't know if Greening was there or not. But anyway, this was a legislative act.
I see.
And that established the Department of Health and a Department of Welfare.
Okay. Were they combined?
So there was
no. Okay. Okay. I'll have to get the year.
And at that time, it was known as the Alaska Territorial Department of Health.
Well, maybe that's what.
So when people say he was the first commissioner, he was the first commissioner of the newly established, reorganized Department of Health.
What he really was the commissioner of the first Department of Public Health. He was not the first commissioner of public health. He was the commissioner of the first Department of Public Health. Would that be correct?
The first legislative.
First legislative. Okay.
Did you read the book The Time of My Life by Devine?
No. I have a list of questions that I'm going to try to get to him just a few at a time.
Okay.
And see if I can do it over the phone that way. Stella says that she says we keep it at 5 minutes, it's all right. So maybe he can do this. But when I go to Juneau, I'll find this out. Now,
okay.
you were in there all this time. You're still in Juneau when we're talking about when it became the Department of Health and they set up the Department of Health. No, you're not there?
Well,
what happened to you?
Okay, in let's see. I arrived in Juneau in 38.
Mm-hmm.
Shortly thereafter, 39, and things started to heat up in Europe.
Oh.
Remember, we're going back now to
right.
Start of World War II.
Right.
And the military decided to establish a cold weather testing facility up at Ladd Air Force Base. They established Ladd Air Force Base.
L-E-D-D?
L-E-D-D.
And where is that?
Fairbanks.
Okay.
And that was going to be, well, it wasn't an Air Force Base, actually. Because we didn't have an Air Force, that was Army.
Army, okay.
Let's call it just Ladd Field.
Okay.
And the purpose of it, of course, was to do cold weather testing.
What would that involve?
Well, cold weather testing of equipment.
Okay.
And of people.
Okay.
Primarily of equipment.
Okay.
But in order to do the construction to have a steady supply and construction, the entire Alaska Railroad had to be renovated.
Oh my. Just for this cold weather testing?
Well, the Alaska Railroad at that time was federal. It was a federal.
Okay.
And the trains ran sporadically.
I understand.
The roadbed was rather erratic. It was lightweight steel. And in order to have a large base up in Fairbanks, they had to be assured of a steady stream of supplies. And also, the equipment they were moving was heavy equipment. And so therefore, the railroad had to be practically built. That is, the roadbed had to be straightened out, and new rails had to be laid. And so this really started the construction boom.
I see. Mm-hmm. Mm-hmm. And this would have been in around 39?
That's 39 and 40.
39 and 40.
Started in 39, actually.
Okay.
Late 39. And there was such a demand, and of course this is high priority, there was such a demand for labor.
Mm-hmm.
And, you know, this was during the days when jobs were paying 40 and 50 cents an hour.
Wow. Mm-hmm.
And so they started to pay $1
Mm-hmm.
overtime. And it was literally a gold rush.
Yeah.
I mean, in Juneau, they were working on the Baranoff Hotel, this big construction project. And then it'd go down to the steamer, buy steerage on the steamer for $25, $30. Leave their jobs behind and get up to Anchorage and go to work. Because you could double their salary.
Yeah.
And then some.
Yeah.
Get lots of overtime.
Yeah. To work on this railroad project.
To work on the railroad. And that created a big boom here in Anchorage.
One more boom.
That was the first big boom.
Okay.
And Anchorage started to boom. So then there was then about the same time, the military decided to establish Fort Richardson, which is now Elmendorf.
Oh, what is now Elmendorf had been Fort Richardson? And what is now Fort Richardson is something new? Oh, is that, or did they just take part of it for Fort Elmendorf?
No, Fort Richardson.
Mm-hmm.
I mean, it was always Army, because it was
Okay.
the Army Air Force.
Right. I remember that, yep, sure.
So when it split,
Okay,
then the Army
okay,
went out.
all right. But they had owned what is now Fort Richardson and Elmendorf, that had that whole tract
This
of land?
whole area was all Army.
Isn't that something?
And so then when the split came, they just divided the military.
I see. Yeah. Mm-hmm.
And so therefore, the doctors up here were asking, since there was such a high demand on medical services, and they need the laboratory support,
Uh-huh.
that we had to meet that demand.
Mm-hmm.
Now, it's true, by that time, there were health centers, there were public health centers, nursing health centers established throughout the territory.
Well, what do you mean by nursing centers? Do you mean hospitals? No.
No.
Do you mean clinics? No.
They were your public health nursing centers.
Okay.
In other words, they're consisting of your public health nurse
Okay.
and her staff, in which there would be well baby clinics,
Okay.
immunization clinics,
Mhm.
and such.
Okay. Yeah, I love the water. That's great. I drink a lot of water.
And so those were already in place.
Okay. All right.
You see, as soon as, remember Nancy, as soon as there was a department organized, there were their respective divisions, and each of the divisions had their functions.
Mm-hmm.
There was a division of public health nursing,
Okay. Mm-hmm.
sanitation engineering,
Mm-hmm.
meal disease control,
Okay.
statistics, analysis, and disease control.
Was this something that was already in place before this department was set up by the legislature? Did you have all those divisions before the legislature got around to creating a department?
These were all established back in 36.
Oh, okay. All right.
Under the Social Security.
All right. Okay.
What I call Social Security.
Okay.
It's a title something I'd have to get you to.
Yeah. Mm-hmm. That's all right. That won't be helpful. It's fine.
And so they all had their
Mhm.
respective,
Mm-hmm.
like we only had one laboratory in Juneau,
Mhm.
but then gradually, I'm just telling you
Mhm.
how I
Yeah.
had to expand to meet the
I
demand.
see. Yeah.
The others had already nursing
Uh-huh.
in order, because they were delivering service at a local level,
Uh-huh. Uh-huh.
and that with their nurses. They had nurses in Fairbanks, in Anchorage, in southeastern communities, and each one had with the help of the community,
Okay.
established a health center.
Okay.
And we always try to encourage the community to participate.
Mm-hmm.
So they had local pride in what was going
Yeah.
on. So this is where the children went for
Yeah.
their immunizations. The mothers brought their children
Mm-hmm.
for prenatal clinics,
Mm-hmm.
and where they went then for the follow-up on well baby clinics.
Mm-hmm.
Then when the doctors came through on crippled children's surveys or things like that, then that health center became the working base.
Okay. Okay.
When the sanitariums came through, they can work out of the health center.
Mm-hmm.
So these were more or less little sub-offices
Mm-hmm.
for us.
Mm-hmm. Mm-hmm.
Now, as I was providing laboratory services, then, or as our division was providing laboratory services, and we had a perishable product,
Yeah.
and a time period
Yeah.
under the system, under the earlier system, the doctors had to get their specimens in the mail by Wednesday, which would go down on the boat train on Thursday, to go out on the boat on Friday, which would get into Juneau on Monday. And I'd pick up the mail sack about, it'd tell me be somewhere between 1 a.m. and 5 a.m. on Monday, if there was anything urgent. Otherwise, I'd get it later on in the morning. And if it was routine stuff, then I could process it until the following week to catch the boat.
Mm-hmm.
If there was something with a dire urgency
Mm-hmm.
that I could take care of, I had to do that between 1 a.m. on Monday and about 8 a.m. on Tuesday.
Oh, wow.
Because that was the boat. Or there were times, the other way, of course, I'd work on the specimen and then get back by telegram to the doctor.
Oh, I see.
Which we could do. Well, that became rather laborious.
I would think so.
So sometimes it'd be 2 to 3 weeks before the doctor would give us a report.
Mm-hmm.
So the doctors up here, through the deputy commissioner for the district, asked that the branch office or a branch laboratory be established.
I see.
We already had a nursing office here.
Yeah.
So Warren Evelyn came up and established a branch laboratory
I see. In Anchorage.
in Anchorage.
They do it anywhere else?
Then later on, as operations expanded, we established one in Fairbanks. And then we also put one down in Ketchikan at the time they were building the Ketchikan pulp mill.
Okay.
Again, because of transportation.
Was that just a temporary thing, just while they were building the pulp mill?
We were hoping to make it as a permanent, but it was a one-man laboratory.
Oh.
And it became very, very difficult to maintain.
Yeah.
And so finally we worked out arrangements with the hospitals for the emergency things.
Okay.
And the routines would come into Juneau.
Okay. So that brought you up here.
So that brought me up here.
And what year
in the
was
40s.
it?
This was in the 40s.
Would you know the year?
1940.
April 1940. Okay. How were you alone in the lab? Were you all by yourself? Do you have any help?
Well, to start out with, it was myself and a dishwasher, the secretary.
I see. And is this when you were down on 4th Avenue? About the time? Yeah. Well, you must know Bob pretty well.
Oh, yes, we did.
And So there you stayed. So then you stayed in Anchorage.
So
you
then
stayed in Anchorage?
So then I stayed in Anchorage.
Stayed in Anchorage.
From 40 on.
Uh-huh.
And except then with my military service, I had to leave the state. Went to England there.
What branch of the service were you in?
I was in the sanitary corps.
I would think you'd be able to use your experience some way, or that they would want you to.
I was assured that I would be, since I had trained everybody and
Right.
the Army used me up here all the time, that I would stay in Alaska.
Oh,
wasn't true.
not so lucky, no.
No, because while I was back at Carlisle Barracks for training, D-Day was approaching, so I was assigned to one of the general hospitals.
In England?
In England. So we went to England.
This is the Army that you're in?
And after VE Day, I thought, finally, I'm going to get home to Alaska. But our unit was assigned for the invasion of Japan.
Uh-huh.
And we were going to be on a hospital ship and supporting the first wave, the first invasion, the first wave. So
Harry saved you from that.
So then I thought, well, fine, I'm going to get back to Alaska.
Yeah.
But I had a critical MO, specialty number, so they kept me in Texas.
What was in Texas?
Well, I was assigned as a laboratory officer.
Okay.
I wound up every time I showed up, the commanding officer would glare at me and say, "What are you doing here? I'm your laboratory officer." Hell, I asked for that one 2 years ago. We're closing the camp. So I went through I went through 2 of those assignments. Wound up at Camp Hood.
Where's that?
Deep in the heart of Texas.
Oh, okay.
Green, Texas.
Okay.
It's where they trained all of the armored divisions.
Oh, really? Really?
It's one of the few military bases that earned the reputation that it's even one where the chaplains deserted. It was.
Isn't that something? Is it still in existence, I wonder?
Oh, yes.
Is it?
One of the Army's big bases.
Is it? Is it?
Big training base.
Well, were you married at the time?
Yes.
When had you married?
We married in 41.
Okay.
Shortly. Yeah, April 41. My daughter was born on the day I was commissioned.
Yeah. So when did you get back here?
Well, I didn't get back until 48.
Really? Where were you in the meantime?
I was in the military from 44, 43.
Well, you stayed in after the war.
I was kept there.
You were kept there? You couldn't get out like everybody else got out? I never heard of such a thing.
If you had a critical...
If you were a regular Army, okay, but you weren't, were you?
No, but I had a critical specialty number.
Oh, my stars. And was most of this time in Camp Wood?
And, scooting around Texas. Poor Eli was joining me each time. And we had our daughter with us. And our first son, Peter, was born down at Camp Hood. And that was something.
Isn't that right?
We lived in trailers. We all had living trailers at that time. Barren, hot, up on stilts.
Buggy.
Get up to about 105. And for the kids, they had a play underneath.
The trailer. For shade.
That was rattlesnake country also. And we had everything down there, big cockroaches and tarantulas. And
Isn't that dreadful?
so, but anyway, so from there, I decided since I was out, I discharged in 47. And,
How did you finally get out?
well, they finally couldn't hold me anymore. She was 47.
Right. God, that doesn't...
And...
yes, you were really a GI, weren't you? And, it's a... wouldn't you consider this someone who entered just for the war?
Yeah.
Yeah.
I was a commissioned officer.
Mm-hmm. Mm-hmm.
But just the same, I had a critical MOS.
Oh, my God.
I kept on telling them. When I got back, they told me, if you are, since you've been overseas, we'll station you to a post closest to your home. That was official policy. I said, fine. I really put in for assignment to Alaska.
Sure.
Couldn't do it. Because Alaska was overseas.
It's still considered overseas, isn't it?
Mm-hmm. Yeah. And so I said, fine, then all right, if Alaska's, if that's the case, then I consider Texas overseas, and I should get overseas pays in Texas. Well, that didn't fly.
No, don't rest yourself.
So, no, I tried it every time that anything came up that was a possibility. I tried it.
Oh, gosh.
47 to get out.
What does do to your career up here? Were you able to just come right back, and was there a spot for you when you got out?
Well, they had granted me leave of absence, military leave of absence.
I see. Okay. Uh-huh.
Then...
wait a second. Frank, I think we're... No? Still going. Okay. I'm going to have to change the tape in a minute.
So anyway, after that, they got me. I got back. Well, 47 I applied. Then I decided, well, since I'm outside, I might as well get my master's in public health.
It's not.
So I applied to Harvard, and they took me.
Good. Good.
So.
And they have a fabulous public health department.
It's fabulous.
Yeah.
And so I went there and took a Master of Science instead of in hygiene. Because I wanted to stay in microbiology.
Okay.
So I took my academic there and I did my research work while I was back in Alaska. So I came back in 48.
Okay. Well, Cambridge must have looked a whole lot better than Texas. I grew up not too far from there. I grew up in the town of Belmont, which is just down the line from Cambridge. Yeah.
Well, my first assignment was over at Harmon General Hospital. It was over in the Longview area, over in the oil fields, close to the Louisiana border. So they were closing that hospital up.
This is after you had got your master's degree?
No.